Hello, this is Dr. Kishor Vora at the Owensboro Heart and Vascular and Riju. I'm going to talk about P-Shot, which is called Priapus Shot. What is P-Shot? First, let's talk about erectile dysfunction. Most men are ashamed or maybe feel awkward to talk about erectile dysfunction. One should not, but there are multiple reasons why one can have erectile dysfunction, whether it is related to cardiovascular disease or the medication for high blood pressure or for diabetes or some other reason why one can have erectile dysfunction. Also, there is anatomical reason, there are blood flow reason, poor blood flow to the penile area, or vein leak, where the blood should get engorged when there is increased blood flow, so it gives erection. Once those are not functioning properly, either the lack of blood flow or vein leak, leaky vein, which does not allow blood to stay there, and that's why one will have erectile dysfunction. There is also psychological problem. There are several different treatments for erectile dysfunction. We all talk about, age-old thing like vacuum suction. Unfortunately, it's very cumbersome, and at the time when you need it, you can't use it. Second, talk about pills, medications like Viagra, and some other medications. All these medications has their own issues. First, it does work as we used for a long time. It does not work always. And second thing, it has some other issues, including cost. It's not covered by the insurance, and also very expensive, and side effect profile including headache and also associated condition can make it not used or can be contraindicated in certain condition, including some cardiovascular disease, especially you cannot take associated concomitant medications like nitrates. So there is other treatment which we're going to talk about today is called P-Shot. It was developed by Dr. Charles Reynolds, and I had pleasure to get trained by him several years back, and we have been doing P-Shot. What it is, it's injection of PRP, which is Platelet Rich Plasma. Platelet has a growth factor. It's used in regenerative medicine for many, many years, like ligamental tear, cartilage damage, bone, some other areas it's been used. Also, what it does, it increases the blood flow. It increases the tissue growth, regeneration of your own natural tissue. So while injecting the medicine or the PRP, which increases the growth of the cavernous tissue, collagens, which is required to support, and also increases the blood flow. And by increasing the blood flow, it improves the erection, and by increasing the growth of cavernous tissue, it cuts down the leak on the vein and hence helps the retention of the blood flow in penile area, which causing sustained erection. How does this work? It's no more than 30 minutes procedure in the office. Once you come in, there's a brief history, then we draw the blood and then spin it at special instruments, and we collect the platelets from there, and then injection done in the base of the penile area where it numbs up with the xylocaine, and then we also apply the cream, and then we inject the PRP. And after that, the procedure is done. We watch you for 10 minutes, and you can have intercourse sex even same day. So there is no surgery, no incision, no cuts. There's a tiny puncture with a needle. We do give vacuum tube, which is actually the pump, because by doing that, it increases the blood flow and enhances the regrowth, the regeneration of the tissue. So we advise to use 10 minutes twice a day for several weeks. It increases the erectile dysfunction, erectile dysfunction, but also increases the growth of the penile penis. We also use this for Peyronie's disease, where the penis, when the erection occurs, it's not straight because of the scarring inside. There's a disease causing scarring. There is a curve, and it's very painful. So it is shown to also work in this. If you have any question, please follow our site, our question for the number. Thank you.